Doctors in the private sector prefer to deliver babies by caesarean section. The Council for Medical Health Schemes says it's more than 70% of births covered by medical aid, and it's among the highest in the world, the rates we have here. Let's chat some more about this with Michael Woolley from the Council for Medical Schemes. Michael, good evening, and thanks so much for your time. What's the concern here?
All right, the main concern here, Yuveka, is the fact that if we were to compare us to international benchmark, we are an outlier because we are sitting at just over 76%. The international benchmark is sitting at 18%. And then again, if you look at your World Health Organization recommendation, the rate is supposed to be between 10 and 15%. So if you were to compare us to other countries, we are significantly high. And again, if you were to look at countries like your Brazil, for instance, they are sitting at around 55%. Similarly with Egypt. USA, for instance, is sitting at 33%. South Africa, for some odd reason, we are sitting at over 70%.
So again, I'm failing to see what the actual concern is here. Are we seeing, that the births are difficult because it's C-section? Are babies not living long enough? Are there complications at birth? Why is it a concern that our rate is so high?
So one of the main findings from the study, for instance, is there's a drive, a perceived incentive for the provider in this specific consent. There's a reimbursement model called fee-for-service. So it's about volumes already. So the more people you treat or the more people you conduct a specific procedure on, then the higher the revenue stream for the provider. So there is definitely an incentive for the provider for these cases. But there are other obvious attributes here, like a freedom of choice by consumers. For instance, if you look at the convenience, the level of convenience after this type of a procedure, for instance. So there are those factors. But ideally, in the main, this kind of condition has to be performed where there are clearly defined clinical reasons, for instance, complications, for instance. But we don't see that in the data. So there is an alarming issue. So again, there's a cost factor here, because if we were to compare the cost of a cesarean section to that of a normal delivery, it's almost twice.
Is it public hospitals you're talking about, not private hospitals? I would imagine if I have a medical aid and I'm going to a private hospital, if I can afford it, so what's the big deal? Is it public hospital?
No, certainly here we're talking about private medical schemes, so we're talking about private hospitals.
So that's what I'm trying to understand. If I have the money and I opt to have a cesarean, it's my money.
Yeah, remember there's a cost element here, because with medical schemes, for instance, the model that is used is a risk pool. So a lot of beneficiaries will contribute to your pool. So whenever you get sick, then those funds are then used to pay for those services. So the impact here, there's an element of waste, number one, and then waste again has a significant impact on contribution increase. That is the first issue. The second issue here, there's an element of waste in terms of where you see some of the providers, for instance, 100% of all deliveries, they are cesarean section. So there's basically no clinical reason that can be attributed to that kind of.
So is the concern also here that patients or mums-to-be or parents-to-be are being misinformed and are being pushed in the direction of caesarean sections because there is a profit for somebody to be made?
Yes, certainly there is a room for members.
And there's not enough awareness.
Yes, certainly this actually is one of the recommendations that we make in the report, to say that definitely there is a room to educate members about the product itself, the offerings, and also just to indicate that we don't necessarily have evidence that says that normal caesarean section, for instance, have got better health outcomes compared to normal deliveries. So those are some of the key issues that we highlight in the report. But definitely there is a room to improve and educate members.
So in that pool, Michael, where you say all medical aid members contribute to that pool, out of that pool comes the, 42,000 Rand for the C-section. That's the average cost of it, right? If there's no complications. Out of that pool, is somebody at the end of this suffering because they can't have the delivery they want, because they're all pooling into the same thing? Does anybody get shortchanged at the end of it all?
No, not necessarily. But remember, what we want to try and do with regards to some of these interventions is just to ensure that we control, because healthcare is very expensive. I mean, in terms of the contribution that members in care on a monthly, on a yearly basis. So it's, by all means, you need to try and avoid wastage in the system. If there's no clinical appropriate reason for a specific procedure, then there's no need to conduct such procedure, because ultimately it impacts on contribution increase to other members as well.
Okay, so that impacts everybody. And then you sit with the complaints as well. So you say you want an investigation into alternative mechanisms to finance maternity. Some examples?
No,
what are some of the...
Yeah, there's a couple of examples here. For instance, like we highlight in the report, that one of the main drivers is the type of reimbursement model, the fee-for-service. So we attribute to say that maybe there's a need to compare with other types of models. For instance, the capitation model, will it be conducive for this type of, as an intervention really to curb the increasing rate? But the main issue, the main concern that we're already highlighting in the report is that if we were to compare us to other countries, it's a staggering figure that we see, and then we're already an outlier, so it's something that needs to be done.
So it seems to me that it's not so much your members, well, they need to be made aware, but you need to be tackling the actual healthcare practitioners, the people who are giving the advice.
Yes, certainly the providers in this case. But also in the report we make reference to other, for instance, medical scheme, the value of contracting, for instance, whereby a medical scheme will contract with the service providers. In this specific case, would be managed care. So there needs managed care entities needs to show value for money in this specific case, because it looks like there's a big gap in that area, whereby it looks like the interventions are not yielding what they are sort of like intended to.
Okay. Well, I wish you good luck on your campaign, and let's see what happens. If more people choose to go the natural route and see what happens, I don't know. But again, everybody does whatever they're advised to do.
Yes. But in conclusion, we don't really want to take away the rights of a patient. The patient has the right to choose, because ultimately they contribute to some of these things. But the main concern is that we don't necessarily find adequate reasons as to why we are completely different compared to other countries.
Okay. Well, thanks very much for your time there. That's Michael Willie from the Council for Medical Schemes.